Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Bicalutamide to reduce minoxidil-induced hypertrichosis in female pattern hair loss. Minoxidil was first introduced as the standard antihypertensive medication, and the discovery of its common adverse event, that is hypertrichosis, led to the development of a topical formulation for promoting hair growth. A recent research published in the Journal of American Academy of Dermatology has found that the addition of bicalutamide to oral minoxidil may improve the minoxidil-induced hypertrichosis. The combination of low-dose systemic minoxidil with an anti-androgen therapy has been found to be effective for the treatment of female pattern hair loss. The prevalence of type 2 diabetes is common in psychiatric disorder patients. Psychiatric disorders are common, they impair the quality of life and are associated with increased mortality rates. While on the other hand, diabetes is an increasingly common disease throughout the world, and estimates suggest that 6 to 9% of the global general population are currently affected. A recent report suggested that people with a sleep disorder had the highest rates of developing T2D, with 40% of the subjects having the disease. It was also proven that the prevalence of type 2 diabetes was lowest amongst people with an intellectual disability, with 8% of individuals having the condition. Improper dental implant maintenance to cause peri-implant diseases. Peri-implant diseases are known as undesirable conditions that can occur immediately after an implant placement. The causes of peri-implant diseases have not been completely investigated as yet. The lack of interproximal cleaning and the presence of plaque and calculus were significantly associated with the development of peri-implant disease in a community-based general practice setting, and the patients reported mixed recall of oral hygiene instructions. Hence, though various oral hygiene measures including floss, interdental brushes and even mouthwashes are recommended to maintain a good implant health. Antiviral hepatitis treatment to reduce post-treatment liver cancer progression. Hepatitis C virus-related hepatocellular carcinoma is a disease with a very high recurrence rate. A new research has highlighted the fact that oral administration of direct-acting antivirals reduce the risk of tumor progressions in such patients suffering from hepatocellular carcinoma after receiving cancer treatment following the recurrence of the liver disease. The study showed that eliminating the hepatitis C virus with direct-acting antivirals suppresses the tumor progression, suggesting contribution to overall patient survival. Thoroscopy considered safe surgical option for esophageal atresia. Esophageal atresia and tracheoesophageal fistula are one of the most common congenital malformations of the esophagus. Thoroscopy surgery of Gros type C has been found to be a safe and effective, minimally invasive technique with comparable outcomes and operative time. For experienced surgeons, now thoroscopy has been found to serve as a first-line technique for such malformation repairs. The researchers of the present study found significant differences in associated anomalies, method of fistula closure, duration of mechanical ventilation after surgery, feeding option before discharge, management of pneumothorax, as well as the prognosis favoring the thoroscopy procedure. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.